health coverage to the population, to the people of Pakistan, the best tool is through the health insurance. And I think Sehat Solar program, its evolution from 2014 till this, they have achieved a lot. Though we are facing some problems in the federating units like AJK, GB and Islamabad, but we still think that if we want to provide best of the best health facilities at the doorsteps, that has to be given through the Universal Health Insurance Program, Sehat Solar program. In 2008, that committee recommended, first of all, that we should go through a legislative process in the Punjab Assembly, and health insurance should be must for all the citizens of the Punjab. Likewise, now we should go through the legislative process that this health insurance facility should be availed by every citizen of the Pakistan, and they should be compelled through law that they should have this health insurance for their families. Secondly, all the public sector hospitals should be run through the Board of Governors, and in 3 to 5 years' time, they has to be self-sustained. Government should not invest any money in the government hospitals, public hospitals. Their hiring, firing, their human resource, everything should be given to the Board of Governors, and the people should be hired from the market to run those public sector big hospitals. Thirdly, the private sector involvement should be baggaged with some of the terms and conditions. They should be like we have seen that we have seen a very mushroom growth in the hospitals, and after that I think 400 to 500 facilities were delisted because they were not providing the best of the best healthcare facilities to the people. So, ladies and gentlemen, this universal healthcare facility, no doubt, it's on the government, and government knows that we have to provide this. Like our esteemed friends here just said, that we are spending only 1% of the GDP on our people for the health. It has to be 3%. Country like Pakistan, who is passing through some financial restraints and economic conditions right now, I think very soon we'll be able to increase this expenditure. We are not asking the planning to give us 3%, we are asking for the 2%. Even 2%, I think, directed properly to the programs like Sehat Solar program can make a lot of difference. So I think this Sehat Solar program is one tool from which we can achieve the dream of universal health coverage in Pakistan. Secondly, today I would like to emphasize, we always talk a lot about the healthcare delivery, about the treatment perspective. We have never addressed, or very much less addressed, even at the planning level. Not only the planning ministry, I'm talking about the health ministries also. At the planning level in provincial governments, we have seen that all the focus of the government is mostly towards the treatment side. We are not focusing on the preventive side. With the country with I think the largest number of HCV, hepatitis C virus patients, the largest number of diabetes mellitus in Pakistan, largest or in top 5 in diseases like tuberculosis. I think it's time that we should focus a lot on the preventive side. We have to work on the preventive side. With a population growth rate of 2.55%, no matter how many hospitals we build, private or public, we won't be able to treat this kind of huge bulk of patients in the coming years. We have to tell our people how to get preventive, how to get themselves away from the communicable and non-communicable disease. So I think this is the message we should take with this universal coverage day, that treatment is one thing, but the main focus should be on the preventive side. Thank you very much.
वज़ीर-ए-आज़म के कोऑर्डिनेटर बराए सेहत डॉक्टर मुख्तार भरत तकरीब से खिताब कर रहे थे। उन्होंने कहा, तमाम शहरियों को सेहत की सहूलियात की फरहमी हम